An SABC News presentation.
Watching Interface here on SABC3. My name is Tembisa Magele. It's very good to be back with you, and a big thank you to Rems Mabote for holding the fort in my absence. Now, as you know, yesterday was World AIDS Day, and after years of battling to control the pandemic, South Africa is finally making progress in the prevention of mother-to-child transmission. That program has ensured a 24% drop in HIV infections in newborn babies. That's something for us to write home about. Now, having said that, let's take a look at this report by Ginosi Queenie, and then after that, we'll chat to Aaron Motsoaledi, who is the Minister of Health, and also Vuyiseka Dubula, who is from the Treatment Action Campaign, right after this.
When Cortlands opened its doors to its first HIV-positive resident 16 years ago, never in their wildest imagination did anyone think that one day the hospice will shut down. The need for a place that was willing to relieve parents dying from AIDS and take in babies and young children ravaged by the disease was overwhelming. Without any hope for treatment, the hospice offered a sanctuary, caring for those who were very sick or comforting them when their tiny bodies gave in. 18 years down the line, the hospice has finally closed its doors. CEO Jackie Schoeman says the accessibility of treatment has saved the lives of many babies and young children.
In 2003, when we heard about the positive effects of treatment, and we, as an organisation, we started to access treatment initially not through government, so we had to pay for it for the first year, but it really worked so well that, you know, we were determined to make sure that every child that came into our care would have that opportunity. And 10 years later, here we are.
Schoeman says they haven't lost a single baby to HIV in the last 3 years. And now the place mainly operates as a transit for babies looking for adoptive parents and a warm place to call home. Cortlands is a shining example of the success of HIV treatment in the country, as well as the prevention of mother-to-child transmission, which has now enabled the organization to shift focus towards helping other children at risk. According to the World Health Organization, South Africa is making significant strides in curbing HIV infections. Campaigns around the use of condoms and safe sex, coupled with HIV education as well as treatment, has yielded some positive results. In Gauteng alone, the number of infected babies has gone down from 11.6% to 2.3% through the prevention of mother-to-child transmission. The center boasts a new toy library, as its emphasis is now to educate the little ones while equipping them with social skills which they will need once they hopefully leave this place. And here, inside the fantasy and dress-up room, little minds can let their imagination run wild and create a future they dream of. Perhaps a future where HIV doesn't exist. Ginosi Queenie, Interface, Johannesburg.
A big thank you to Ginosi Queenie for that insert. And joining me now is Minister Aaron Motsoaledi, and we'll be joined by a member of the TAC a little bit later on the program. Minister, let's welcome you. Thank you so much for joining us.
Thank you, Tembisa. Thank you to the listeners.
The shutting down of a centre like the Cortlands Baby Sanctuary, does that bother you? Is it a sign of something that we should be worried about, or do we celebrate because it means that the infection rate is coming down?
Oh, absolutely, we celebrate. When I was told by a BBC journalist, I didn't know about it. Yeah. It's not me who discovered and reported about it. It was a BBC journalist who told me about it as a sign of our success. But what I used to hear before was anecdotes. There are two main anecdotes I've heard. Somebody from Piet Retief telling me that the only funeral parlors in that town are closing down. Remember, that is a district in Mpumalanga, which is one of the hardest hit. Then another person told me that in a small hospital somewhere in Limpopo, they used to outsource the collection of corpses to 5 private mortuaries because the mortuary of the small hospital could not cope. And we were saying recently they found two mortuary, what you call owners fighting, operators, yes, fighting over a corpse. And one of them made a reckless remark and said, gosh, since this program of theirs has started, our business is suffering, you know.
Yeah.
So those are the anecdotes we've had. But what we know, not from anecdotal evidence, but from empirical evidence, from research, is the fact that, yes, the number of people who used to die of HIV/AIDS has tremendously dropped because life expectancy has increased.
That's wonderful news, Minister. But is that due to ARVs? Can we attribute it solely to the availability of ARVs?
Remember that our turning point can be traced back to World AIDS Day, December the 1st, 2009, when President Jacob Zuma, sharing the platform with Michelle Sidibe, Executive Director of UNAIDS, he addressed these issues and announced 4 major programs which we need to undertake in order to combat HIV and AIDS. But those were programs about treatment. But the following year, precisely on the 24th of April 2010, the President Jacob Zuma launched the biggest HIV counseling and testing campaign, yes, what you call HCT campaign, at Natalspruit Hospital, signaling the start to test 15 million South Africans. Remember, we have never done that. No country has ever tested so many people at the same time. For them to know their status, yes, for them to be aware, for them to know that there need to be prevention. But we also launched the massive medical male circumcision campaign in the country. And since we started, more than 600,000 males have gone through that program. So it is a multiplicity of programs.
But what is your strategy,
central to it is that treatment has been very important,
yes,
including the scale up to mother-to-child prevention of mother-to-child transmission,
which has gone down drastically, and it's something, yes, for us to rejoice about. But if you look at the focus of the government, not just this administration, but government in previous administrations, has been to really try and fight against HIV and AIDS, and rightfully so. But now that infection rates are coming down, what is your strategy? How are you moving forward?
We want to accelerate. The fact that things are coming down doesn't mean we have won the battle. Somebody yesterday asked me, have we won the battle? I said, no, by all means, no, but we have turned the corner. We are now homebound. We have turned the corner. If we're in the wilderness, we now see direction. There is definitely light at the end of the tunnel, and it's not that of an oncoming train. It's light to show that, yes, we are getting out of this dark tunnel. But now what we need to do is to accelerate. If you look at the NSP, National Strategic Plan, National Strategic Plan for HIV and AIDS, launched by the President and the Deputy President on World AIDS Day last year in Nelson Mandela Bay, you realize that we want to accelerate, but also, secondly, we want to change the structure of SANAC, South African National AIDS Council, which is very strong nationally, chaired by the Deputy President. We want it to go down so that in every province there is a strong structure like that, provincial AIDS council like that. At the moment, the strongest is the one in KZN, is the one that is working very well. The others are going on, but not as strong as that one. And we wanted to emulate what they are doing. We want to take it down right up to the district level, where the district mayor doesn't only regard themselves as politician, but as agent to fight HIV/AIDS. We want to take it to the local, where the local mayor will do the same thing. We want to take it down to the ward, where the ward councillor, regardless of what party they belong to, are champions in this regard. That is the structure that is in KZN. And not surprising, the biggest achievement, this prevention of mother-to-child transmission, which reduced from 8% to 3.5% in 2010 and to 2.7% in 2011. The biggest gain was made in KZN because of this structure which involves everybody.
Okay, so now, does that mean that with the ARV tender that I want us to talk about after the break, that you've just announced, that you are focusing more on driving more ARVs to the ground, to people at the various levels that you've described? Or will you be diversifying and looking at other aspects that you need to be focusing on?
Well, if we go back again to December 2009, the president announced the categories of people who needed to be treated. Remember, during that time, we were only waiting for people's CD4 count to drop to 200 or less. That was too late. He then said pregnant mothers must start treatment at 14 weeks rather than 28 weeks. People who are co-infected, that means who have got both HIV, AIDS, and TB, must start when the CD4 count is 350 or less. And mothers who are pregnant who don't fall within that category, which I've just mentioned, must start also at the CD4 count of 350. And children who are born HIV positive, regardless of status, regardless of CD4 count, must start treatment immediately. Yes, that was in 2009, and we started the program in April 2010. In 2011, on September, the Deputy President announced what we call universal treatment, that for every human being, regardless of these 4 categories, who is HIV positive, once the CD4 count is 350 or less, they also continue on treatment, start treatment. That's what we started last year in November. So we've been making huge announcements all throughout the way, and that has helped.
Does this mean that we no longer have room for, garlic and beetroot and all of those good things, including the African potato? Are we not promoting that good diet, which was the emphasis in the previous administration?
Let me start here. Good diet has always been throughout ages, and it will always be. For every disease, you need good diet because you need a very strong immunity. But diet is not treatment. I think that's the difference. But there's no disease in the textbook, especially an infection, that does not need good diet in order for you to cope with it.
But we're not emphasizing
but
it
diet
as it
alone,
was in the
no,
past.
diet alone is not treatment. I'm just saying it's not about HIV/AIDS. Many people thought so. You need only good diet in HIV/AIDS. You need it for all infections, for all. And it's not something that needs to be debated. It has been there for ages. Ever since I went to medical school, in every textbook, you'll find the issue of good nutrition is important. That is why last year the World Organization held a meeting in Brazil about the social determinants of health, because health is not only caused by biological organisms. There are very serious social determinants, because most of the infections are socio-economic. If you are very poor, you'll be affected more than those who are better off.
Yes, and that was the argument previously. But let's continue this discussion after this break, Minister, and we will be taking your messages on our Facebook page and also on our SMS line. Remember, it's 33726. We're back right after this. And you're back with us on Interface, and we're chatting to Health Minister Aaron Motsoaledi. World AIDS Day was yesterday, and we are celebrating this time around. We're not lamenting much when it comes to HIV/AIDS. While there is still progress to be made, we have made strides as a country, and we are saying hats off to not just you, Minister, but the government and everybody else that is involved in that. But while we are commending what has happened, what has been done in terms of the strides that have been made, there is still a concern that the infection rate is still too high when it comes to young people aged between 18 and 24 years old. What do we do about that?
Oh yes, that's true. Remember, at one stage in sub-Saharan Africa, the biggest worry, even by funders, was that for every one person put on treatment, 2 more get infected. And that's why the issue of prevention is extraordinarily important. And that's why we've put emphasis on this issue of prevention of mother-to-child transmission, on the issue of male circumcision. And now we want to step up the issue of condoms, distribution of condoms. Remember, we're distributing only 450 million condoms, and we want to step it up by more than 200%, maybe to about 1 billion. And also female condoms. Those we have stepped them up from only 1 million to about 6 million, and we're still continuing.
But Minister, is that where the problem is really? Because for as long as HIV has been around, the message of condomizing has been preached, and yet you see the numbers climbing.
The message preached was abstain.
Yes, be faithful and condomize.
Be faithful and condomize. We do know that abstaining is not happening. It's happening to some people, but very few. And I'm not saying the message must be stopped.
Sure.
But the fact that, for instance, last year alone we had 94,000 school pregnancies, and separate from that 77,000 abortions, shows that among our young people the issue of abstaining is not taking place. The question is whether there is faithfulness, but even if it's not, is there faithfulness, doesn't mean it will definitely stop HIV, AIDS, or even pregnancy. Now the message that is left is condomizing, that people are having sex and they need to be using condom, they need to play safe. Fortunately, it has just been shown by Johns Hopkins University, a research that was announced in Washington during the International AIDS Conference, that the use of condoms have actually increased tremendously in our country. And we just need to up that one. We've got no option but to preach prevention messages, and condomizing is one of those.
But Minister, if you talk to the churches and religious organizations, if you talk to traditional councils, they'll tell you that the government is not giving the message of abstinence a fair chance, because you're pumping millions and billions into the distribution of condoms, but not giving them the right support as organizations that are preaching abstinence to go out there and reach as many people as possible. And that if you were to put money behind their way forward, you would see some progress.
By the way, Tembisa, if people were listening to the churches and religious leaders, we wouldn't be in this problem. By the way, let me just spread that message. Yes, we would not be in this problem if they were listening to them or if they were being successful. In fact, if religious leaders get successful, I'll be extremely happy, extremely excited. They preach that in the church every day. It's their moral code to say people must abstain. And if people were listening, I wouldn't be having so much in my hands because there wouldn't be so many infections. And the
point
fact
I'm
that
making to you, Minister, is that although you've got the condoms accessible in a lot of public areas, and everybody knows that if you condomize, from the messages that we're getting, that that's the way to go, that's the prevention way to go. But still, we see the numbers climbing. So even though you're saying that we are making some progress there, we should be making it at a higher scale, particularly with young people, and we're not. Are we not missing where the problem is?
Yes, but your question is they are blaming government and say it's not giving it a chance.
Yeah.
As if government stop people from abstaining. Government has been part of the preaching, but I'm saying the moral code of those who are religious leaders is mostly abstaining than anything. But government has to act when it's, following empirical evidence. If everybody else say abstain and people are not abstaining, they are dying. Surely you don't expect me to fold my arms. But we must keep on trying. And it's not government only. This is a societal problem. It will be defeated by society together. And if you look at our 10-point program in health, we said we must provide strategic leadership, but create a social compact with society for better health outcomes. We are providing the leadership now, and we are busy doing this social compact with society. Number 8 talks about mass mobilization, that people need to be mass mobilized at the high level. And I've just given an example of the SANAC, how the South African National AIDS Council must look like, that the model in KZN goes right up to the ward. And it's starting to show results, and we want each and every part of the country, because once you did so, Tembisa, everybody gets involved. If you look at the HIV/AIDS model, the SANAC model in KZN, you'll find even journalists there. General manager, of course, the FM sits, and they tell him that your radio should do this. Yes, ministers of religion sits, Amakosi sits. The person who gives the report are not health workers, actually. It's the mayor of the district. He gives figures in that meeting of mortality rate, of child maternal mortality, of child mortality rate, of PMTCT,
We have to
of
take a
teenage
short
pregnancies,
break,
of
Minister.
abortions. You know.
I hear you.
Yes.
I hear you.
Yes.
All right, 33726, that's our SMS line, and Interface on SABC3. That's how you find us on Facebook. Right after this, we continue with this discussion.
The executive director of UNAIDS said he will even recommend it to Southern Africa because he said it's not an AIDS council, it's a council of the people of KZN because they all sit together. Some of the MECs even ask how are these mayors medically trained? They are not used to a district mayor.
So there's an ownership beyond the
Ownership
politics.
beyond the politics, you know, and it goes across parties. The premier is there is chairing. It doesn't matter which ward is held by which political party, you know, they all believe they are there for the same. Yeah. It's quite miraculous.
Sure.
And that's why I remember the prevalence was the highest there. But they are the ones who reduced mother-to-child transmission more than all the provinces when they had the highest prevalence.
When they had the highest.
Because of this method.
I think that's an important point to make when we come back. If you can make that point that you had a province that had the highest infection rate, mother to child, and now they've been able to reduce it the most because of that working together. Because we get too entangled in politics.
Oh, yes.
That's the problem.
Okay, 10 seconds to go. The next segment is 5 minutes long. And the Cape Town is cancelled.
Okay. I want to ask you about the vaccine that those two ladies are working on. That's very interesting, but I'm not sure how much time we've got.
5 minutes.
4 minutes.
4.
Okay.
Okay, we're coming back.
We had wanted to chat to Vuyiseka Dubula, who is the Secretary General of the Treatment Action Campaign. Unfortunately, she couldn't join us tonight, but we are still with the Minister of Health, Minister Aaron Motsoaledi, talking about the progress that's been made when it comes to HIV and AIDS in the country. Now, Minister, the reports that we spoke about earlier about the shelters closing down and, you know, NGOs, which is what I wanted to ask Vuyiseka about. Many of them are now out of work and they don't have anything to do because the infection rate is coming down. What is the government doing to try and make sure that there's maximum participation by NGOs still, even though this good news means that there's less for them to do?
Out of work.
That's what they're
I'm hearing
claiming.
that for the first time. There's
That's what they're
a lot of
claiming.
work to be done.
The funding is not there for them.
Yes, they rather say they don't have money, but not out of work.
Yes.
It's like saying we've been successful so much that doctors are out of work, meaning then they mustn't work hard because they'll be afraid to be out of work.
But they're closing down.
It's an issue of funding. It's not because they're out of work. They've got more work to do. It's an issue of funding because most of them were funded from organizations like PEPFAR and outside funders from Europe and America. And you know they've got their own financial problems. And when they did austerity measures in Europe and America, they looked what they could cut off and they said, this funding of HIV/AIDS, let's hold back. That's where the problem is.
But if the government is recognizing that there is still room for them and work for them to do, if the European and American funders are saying we don't have the money, is government going to step in and say, look, there is work for you to do, so we will now put funding there?
We're trying to do that. For instance, there are quite a number of people who were on treatment through PEPFAR. I can't say PEPFAR is closed, go and die. We are taking them over. But we can't take over everything, the payment of NGOs, but we do have a program of what is that which must take over. And believe you me, we do respect and value the work done by NGOs. Without them, we'll never win this battle.
So there's still room for them in this battle?
There is absolutely room for them. There's room for every single South African.
And government will be supporting them more?
We are trying to support them where we can. But what we are not able to do, Tembisa, is for an NGO that has hired lots of people, administrators, clerks, is getting funding from PEPFAR, just to translocate it wholly and say, come in, government will fund you. We don't really have funds for that because our budget is fixed and limited.
Okay, Minister, another good news story. I was reading about two ladies that have possibly discovered a vaccine for HIV. What's the story there?
They haven't discovered the vaccine. There are two ladies who were under the CAPRISA program. CAPRISA program is that program that is working on a vaginal cream.
Yes.
That will help women, protect themselves, because at the moment they don't have anything to do so to protect themselves. And it was found that those ladies have got antibodies that kills close to more than 80% of the strains of HIV available. And that discovery is making it possible for scientists to see the possibility of a vaccine. Because all this time they were working in the dark to try to look for a vaccine. Now they've got a path which they are following. And I must emphasize, we've not yet found a vaccine, but it's again the light at the end of the tunnel with the discovery of those antibodies from those women.
What's the way forward now from there, now that those antibodies have been found?
They're working very hard. Yeah. Not only in South Africa, scientists around the world are working on that project to look at making use of that finding or that discovery. All they said is that the advent of having a vaccine has been brought much nearer when it was many years away. It has come nearer, and for scientists to work together, they will definitely arrive at the vaccine much sooner than they thought.
That's good news, Minister. And we commend you for the work that you're doing in your ministry, and also everybody that's really working hard to try and bring down those statistics. Last words from you for South Africans?
Yeah, I just want South Africans to work together, but for this, let me abuse this opportunity, unfortunately, to send condolences to the government of Free State, the Department of Health, and indeed the family of the MEC, the late MEC for Health in the Free State, who passed on last night in a car accident. It's something that is very hurtful, but want to say, let's continue the work, maybe even continue a legacy, because she was worried that the Free State province is number 3 in the country in terms of prevalence. So we're working very hard on that.
And hopefully the good work that's been done in KZN that we spoke about earlier will be duplicated in other provinces.
Yes, she actually went there to go and learn from KZN. Okay, so we believe everybody else will do so.
All right, we've run out of time, but thank you so much for joining us, Minister Aaron Motsoaledi, talking to us about what's been done when it comes to HIV and AIDS in the country. Remember that you can keep in touch with us. Interface on SABC3. That's how you find us on Facebook. Interface on 3 at sabc.co.za. That is our email address. And 33726 if you still want to keep those SMSs coming. From me, Tembisa Mahel and the team, good night.